All right, so I thought we would just get together and talk about things that were on your mind about COVID-19 from the aspect of an employer. Last time we had a little bit of talk, and it seemed to, I mean, we had some questions. Now, first of all, I'd like to see if anybody has any questions from an employer standpoint relating to COVID. If not, then I do have something prepared that we can talk about, and it's about testing, specifically antibody testing versus the PCR test. So before we do that, does anybody have anything that they want to ask? Okay, well, you can let me know a little bit later. I'm going to talk a little bit about testing. So we hear a good bit about testing in the media. Right now, what we're hearing is that testing is only supposed to be done for folks that are symptomatic. Although we know from the cruise ship incident and also from a nursing home in Seattle that about half the people that test positive are asymptomatic. That means they're not showing symptoms. So they can be a carrier out there. And we also know from the data that's out there, the research, that one person infected with COVID-19 can spread it to somewhere between 2 and 3 people. So there's that just underscores the great emphasis on the social distancing and hand washing and sanitizing and all of that. But now there's another option available. It's just been approved by the FDA last week, and that's testing for the antibody. So that's what I'm going to talk about here in a minute. I'm going to explain to you a little bit about how that works, along with the PCR test. The PCR test is the current approved test, and that test for the active disease. It actually looks for a little piece of the virus. Now, we don't hear this a lot in the media, but that test isn't always that great. In other words, there's some false negatives that can be generated by doing that test, and I'll tell you why. Part of the reason is because disease is infecting your body. It's doing that. It's disease thing deep in the lungs, in the air sacs called alveoli. And so really, that's where the best sample for a test will come from. But of course, we can't reach down into somebody's lungs, into the depths of their lungs and get a sample. So we kind of back up to the next best thing, which is going to be in the back of the throat or the back of the nose. So every step away from deep in the lungs is going to be a step away or a step more distant from getting the kind of sample we need to get a really good sensitivity on the test. So just keep that in mind too. It's not, I mean, it's got its drawbacks too. Okay, plus it's pretty expensive to do that test. It's got to be run on some sophisticated machines, and it takes hours to do the test. Whereas the antibody test, it's a finger stick, and it's done in a doctor's office like mine in 15 minutes. Okay, are there any questions about what I've shared so far? Yeah, I'm going to share my screen and show you a little bit of the science behind it. Now, my goal with this is, here, share. Okay, can y'all see that? Okay, you can see that. Now, my goal with this is to show this to you so you can make a decision for you, your company, and the people that you are responsible for. What I'm showing you here is kind of the timeline for the antibodies and the timeline for exposure of the disease. So ground zero here is when a person will start to be symptomatic, and we're showing that up here by this little bar where it says fever. Of course, on the bottom, we're looking at days. And over here to the left of zero, this is the incubation period. It could be even longer than 11 days. Most of the time we're talking about 14 days. So here we are over here on this timeline. Somebody gets exposed to COVID-19 and it's incubating in their body. And then at ground zero here, day zero, it gets to a point that there's so much virus in their body that they start to be symptomatic and have a fever, cough, shortness of breath. So at that point, we can see on this timeline, the body's immune system is starting to react. And the first antibody that it creates is called an Igm antibody. And Igm is the broad classification of the kind of antibody that is responsive in an acute infection. That's why you see the level go up and then it peaks. And then after the infection basically starts to get under control, this antibody goes down. But then 7 days after you're symptomatic, there's another antibody that starts. That's an IgG antibody. And that level rises up here and it stays high for a period of time. And a lot of times this is the antibody where that we look for to show if somebody is immune to a disease. Like if you've ever had the hepatitis B series, this is the antibody that will stay high that we're trying to generate, because this is the one that's going to be working for you if you're ever exposed to that disease again. Now, here is, I'm showing it down here with this guy, where the PCR test is used. It's for symptomatic people. Then symptoms are occurring right in here. Okay. Now, here's the problem with COVID-19. So this just shows that from the cruise ship, there were 619 confirmed cases. Half of the 619 confirmed cases were asymptomatic. Okay, and here's the numbers from the nursing home. I think it's the one in Seattle. The 23 residents were positive. About half of them were asymptomatic at the time of diagnosis as well. So when we go back here, we're looking at the way that the guidelines are set out by the government now to only test the symptomatic people. Well, so we could be missing half the people that are a carrier. And I put that down here. So this is where the carrier state is going to be on this timeline. It's possible it could extend out here more. It's possible that it could extend out here more. But this is what they say right now is that the highest chance of infecting somebody is when COVID is symptomatic or in your body. But in the case of asymptomatic individuals, we know that they can still pass it on, obviously, because it's happening and it's well documented already. So now here's where we can use the antibody test right here to detect these folks that are asymptomatic. The antibody test is done in the office. It takes about 15 minutes. It's done with a finger stick, and it's pretty sensitive. One other thing that you should know, though, is if we do an antibody test here and somebody is infected, there is a chance of a false negative. That's probably about 10%. But if we do another test 3 or 4 days later, it'll be much more sensitive, and the sensitivity of that will be way up in the 90s. So if we suspect someone, we can do an antibody test on them and see if they've developed antibodies to COVID, and if that test comes up negative, we can repeat it in 3 or 4 days, and the sensitivity to that will be a lot greater. So here's where I see that if an employer or an individual wants to be very proactive in checking to see if COVID is among your company already, you can do that now. If you want to be really sure and really proactive, you can do a second antibody test 3 or 4 days later. And by doing that, you can find out if there are carriers or asymptomatic folks with COVID within your company. If there are, then of course, those folks would need to be isolated, and their contacts. So what I would recommend then is, if somebody did come up positive with the antibody test, that they be put in isolation for 7 days, and then their contacts be put in isolation at home for 14 days. Okay. So I've been talking a good bit. Does anybody have some questions about that?
Dr. Roger, this is.
I don't know.
Go ahead. I'm sorry.
Hi, Sloan.
No, I was. Hey, go ahead, Sloan. I'll ask after you.
Okay. My question, Dr. Roger, was with the antibody test. Would it be correct that once you test positive for it, you will always test positive because your body then has antibodies, the antibodies in your blood?
Yeah, that's a good question. And the antibody test tests for 2 kinds of antibodies, the IgM and the IgG. And ideally, we would like the IgG to stay up, because we hope that having those antibodies will mean that you're immune to another COVID infection. The IgM antibodies will go down after a couple of weeks or a month or so, as the graph shows. However, we still don't know if those antibodies that are developed from the COVID infection will fight off another COVID infection, like next season, or what, or even a reinfection, because there are reinfections occurring out there. So this is a brand new disease for the whole human race, and so we're still learning a lot about it. But now, if you think of the flu, we develop antibodies to the flu every year, but that virus changes every year. That's why we have to create a new flu vaccine every year, and then everybody's got to get that to be protected. So we don't know if COVID is going to act like that. We just have to kind of wait and see, unfortunately. But I can say that there is research going on to try to collect antibodies from folks that have been infected with COVID and resolved. Then they will inoculate those antibodies into folks that are fighting the infection right now, to see if that will be helpful for them.
Thank you.
You bet. Was there another question?
So
I was just going to ask the current test that you're using. I guess when do you think it'll be available? And then I assume it's I'm just calling in. I don't have the video in front of me or the graph, but I would assume it's testing for both types of antibodies.
That's correct. Yeah, I did pre-order a bunch of the antibody tests, and it does check for the IgM and IgG. So we should have that hopefully in next week, I'm hoping. But we also have the PCR test that we can do on folks that we feel need that or want that. We have that one too. That one, of course, will have to be sent out. And we are set up to do video consultations with folks when we need to do that. And we're trying to do the video visits with people who have respiratory complaints. So they're not having to come into the clinic, and we're not having to expose them to others here or bring COVID into the clinic to keep the clinic clean and safe.
Dr. Roger, with that test, would I be able to also know when it would be safe for an employee to come back to work?
Okay, let's see. I'm just trying to understand your question. So now, I should have said this at the beginning. I need to be very careful about how I talk about this COVID antibody test, because we're not supposed to use this test to say that somebody has the disease or somebody doesn't have the disease. But as a clinician, I feel comfortable treating patients and giving advice as to treatment and return to work and things like that. And it's because of the graph that I showed you. You know, it's because I understand the science and I understand the limitations. So to answer your question then, Shankar, what I would do is something like this. I'm going to share my screen again. Okay. So can y'all see that? Can you see that?
Yes, we see it.
Okay, good. So if somebody came into the clinic and they were asymptomatic and both IgM and IgG were negative, I would have them continue to do social distancing, hand washing, and all the preventative measures. And then if we were really concerned about them having an exposure, then I would recommend we repeat the antibody test in 3 or 4 days. If somebody had an antibody test that was positive for IgM, I would say that we treat them as a positive. Now, you can see the IgM is the one that reacts acutely. We would send them home and treat them symptomatically. Well, they're asymptomatic. So anyway, we send them home. If they do develop symptoms, and we treat those symptoms, and we would also then consider treating or isolating their contacts. And see, here's where I think the great utility comes in with this test, because we've found someone that was asymptomatic with a positive IgM. Now we can take this a generation further and go isolate their contacts for 14 days. So now imagine if we would have not found this person. That means they're still going around the company and potentially infecting other coworkers. Okay, and then So this person might become positive a week later or 2 weeks later, but they've already spread it to how many people? We don't know. But then 2 weeks after that, that group of people have spread it to a multiple of other coworkers. So you can see how fast this can spread. And so that's why I wanted to present this science to business owners, because you guys are the ones that can make the decision on how aggressive you want to be on keeping operations going. You can make the decision if this might be a good fit for you to test, and then how many you want to test. It might not be a good fit for you at all because your folks are out and about, or they can work at home. But if you have a group of people that are working closely together in the same shop, well, it might make more sense for you to try to be proactive and test them regularly to try to avoid them spreading it amongst themselves before somebody becomes symptomatic and then they're all taken out. So then in this last case, we just have both positive, the IgM and the IgG, and we would treat them as active disease and consider repeating the antibody in 3 days and isolating their contacts. So now let me just back up for a minute, explain something about treating them as if they have active disease. That's already going on with or without the test. So this is not something that's real radical or just something that I made up. But as you can imagine, there is, as we see in the news, that there's a shortage of these PCR tests. So doctors and healthcare workers are out there treating people they're treating them as if they're active even without the test. And that just makes sense, because if if we have a real strong suspicion or they have the exposure, but we don't have access to the test and we don't want to wait a week for it to come back from LabCorp, we just treat them as if they're positive. And, we even do that with the flu as well, without even a positive flu test. So I hope that makes sense to y'all. Did that answer your question, Shankar?
Yes, it did.
Okay. Any other questions about that?
Do you mind just briefly going back to your first slide, just with the curves?
You bet. Okay.
Thank you. I just wanted to take a quick look at it before you went to the last slide.
Okay. Oh yeah, the last slide is just showing the same results here that are possible if we have a symptomatic person. It doesn't change too much, but they have the symptoms. So in this case, we would consider a PCR test over here, and that's the one that looks for the piece of the virus itself. Okay, but you can see that we would treat them the same way. We would treat them at home for 7 days, and we would treat we'd want to isolate their contacts as well.
And then on your third slide, it didn't show a negative positive where you just have the positive for the IgG. I'd assume that would mean you've already had COVID-19 and you just got the antibodies.
Yeah, this one right
and
here.
You don't have active disease.
Yeah. So here you're asymptomatic, and then there's possibility here you could have a negative IgM and a positive IgG. So that could be a scenario where somebody was exposed like a month or two ago, They might have been asymptomatic at that time, and now they still have the elevated IgG.
So I guess from an employer standpoint, that would probably be your lowest risk person to kind of get back into the workforce if they're, you know, having to be in proximity to other people.
Right, right. But it would also prompt you to think about if they did spread this to other coworkers in the time that they were active, or when their IgM was elevated.
Yeah, like silent carrier.
Yeah, yeah. And so then how would you find that? Well, then you would want to consider testing everybody in the whole shop, or at least who this guy was exposed, or who this guy works with.
Yeah, I think that's the takeaway is universal testing is kind of the only way to really get after it.
Right, right. And so I hope that makes sense to you guys who are employers and decision makers. So I just, I'm not trying to oversell this test or that one or say everybody needs to do it, but I'm just trying to present the facts, the information, the science, so you can make the best decision for your company, your employees. And then to let you know that it's available to do, that we have this test here. We should have it in the next week, I hope. Okay, good questions.
Is it one specific, sorry, I have a lot of questions. Is it a specific vendor that you're getting the test from? Because it looks like there's been a few that, you know, I've been kind of watching this closely. There's been a few that have been approved for the emergency use.
Yeah, and that's a good question. We're hearing a lot about testing these days. There's the Pcr test that has been around. That's the first one. That's the gold standard. And now everybody is rushing to try to make testing more available and accessible. So then the antibody test started to come on the scene, and there was a company that I'm dealing with that started shipping them last week after they got approved. So I think that they were out there, but they weren't authorized to send them out until the FDA approved them to be sent out. That's the way I read the notifications that came out. So now we're required to say that the FDA has not reviewed this test. So it's okay that it's out there, but we just need to let everybody know that this test has not been reviewed by the FDA. Then we just heard about another test, which is the Abbott 5-minute test, which tests for the antigen. The antigen is the thing that stimulates the antibodies to be produced. In other words, the antigen is the virus itself. So it's testing for the active disease. It's testing for the part of the virus. But that test is now, I mean, the reagents for that test are being diverted to the parts of the country where the disease is real active. And so that test also is limited by that, and it's also limited by the hospitals or doctor's offices that have that one specific Abbott machine. Okay, so that's that test. Then we can hear about other tests coming out in the media, like a self-test, or where you swab yourself at home. But just remember what I said about where the sample comes from. You know, if I can imagine that if we start letting people self-test themselves, that the chance for false negatives will be really high, because, like I said earlier, the disease process is deep in the lungs. So the further away from that we're getting, the more false positives we're going to be getting in our testing. Once we get the sample of blood, the test itself is pretty accurate with the antibody test.
That sample of blood is really more like doing an AccuCheck for like what you see diabetics do. So it's just a fingerprint, finger prick, correct?
Exactly, right.
And then as we're talking about maybe multiple employees getting tested, you know, is there insurance coverage or out of pocket, you know, a cash paying patient, what the cost of the test is going to be?
Yeah, as far as I know, this is not going to be reimbursed by insurance because it's not approved. So what we're going to be charging employers to do this test is $35 for the test.
Okay, not too bad at all.
The other test that we have available is the PCR test, and that one costs $150 with a 24 to 48 hour turnaround. We have that one available to us as well. Of course, we'd screen that one too. We'd probably want to reserve that one to someone that we think probably has COVID. And actually, as a clinician, I'm glad that we have both, because if we do them both, and then it gives us a better chance of catching a false negative. For example, I was listening to a webinar day before yesterday. There was a doctor. It was for doctors, and there was a doctor on talking about the course of the disease in herself. In other words, she was actually working from home in bed, and she had had COVID for a little over a month, maybe more like 6 weeks. And she described step by step how she was exposed and how the disease evolved in her body, because it was a progression. And she actually mentioned that she had 2 PCR tests when she started being symptomatic, and they were both negative. So, wow, you know, like I was saying, that test it's got its limitations as well.
And you said you think the false negative rate for this test is about 10%. Mm-hmm. And then what about for a false positive?
The false positive is that one has been tested, and it's not really a concern. I don't have the specific number, but that one it's not that critical, because if we do call someone positive, we're going to send them home for isolation, whereas the false negative is a lot more important because we don't want to miss that one. If we miss a false positive, that's very forgiving in the overall picture of what we're trying to do here with testing. But if we have a false negative, then we've missed a carrier, you know, that could still be out there spreading the disease. And that's where we're trying to prevent in testing the asymptomatic folks. Another good fit for the antibody test is if someone has been having respiratory symptoms for a week or two, and they don't really fit the mold of fever and shortness of breath and lower respiratory signs, we can do this antibody test on them very easily and screen them for COVID this way.
Well, Dr. Roger, for me, it just seems like that there's a lot of business owners and employees who can't get the test, who would like some type of reassurance. Hey, I'm in pretty good shape, because there is so much misinformation flying around. For me, it would just seem like it's not a clear you forever type test, the antibody test, but it seems like it would create a little more of a peace of mind. If a business owner had 4, 5, 6 people in office, they're around each other all the time, it seems to me it would at least create more of a relaxed environment, knowing, hey, we're checking this, we're watching this. So I think it's a very positive development.
I think so too. We've had, some patients reach out to us and with great anxiety, like, I need to be tested. So we can add an element of comfort for them by doing this test on them. If business owners are noticing that in their employees as well, this could be something that you could use to give them a level of comfort or relief for the morale of the company. And of course that's going to be your decision. Like I said, I'm just trying to present the science and show you the tool that we have and let you decide how and when you might want to use that. But we're here to help if we can.
And Dr. Roger, if somebody does get a test and it is negative, so they know they have, at least they feel like they have not been exposed to it, that still doesn't mean that they couldn't walk out of the door and 10 hours later be exposed. And so, it doesn't mean that couldn't change after that test is done. Am I correct on that?
You're exactly right, because especially with folks that are out in the community, like they're not on the they've got the kind of job that they're still out there working. So there's still that risk out there of exposure. So the test is simple enough and might be economical enough for some folks to do it on a regular basis, for folks that might be at high risk for getting exposed to it. But that's right. So somebody could test negative today with the antibody test, but then next week come up positive. And that could be because of the false negative, but it could also be because they've been exposed. And I feel like as more and more community outbreaks happen, that the more that happens, the more that we might want to be using the antibody test or staying home. If we can't stay home and avoid it completely, we have to be out there, then the antibody test would be something to consider. Well, does anybody have any other questions? It doesn't have to be about this test. It could be about anything else.
Okay, doctor, I do. This is Debbie.
Hi.
I know you don't have a crystal ball, but when are you expecting, and are you expecting San Antonio and surrounding areas to look like what we're seeing in Louisiana, let's say? Do you expect that?
I think it's going to get worse before it's going to get better. I hope that it doesn't get like New Orleans, but I do feel like it will likely get worse, and I feel that way because there are so many folks going around. They're carriers, One infected COVID person spreads this to somewhere between 2 and 3 people, and gosh, it just kind of it's happening invisibly. So that's why I feel kind of strongly about the antibody test and want as many people to know about it as possible.
I'm sorry, one last question. When you get the antibody test, let's say within the next week, I guess two questions. How are you going to announce it, in terms of having the availability of it? And then what does the supply look like? The diagnostic test, obviously, it's going to people that have symptoms and to first responders and healthcare workers. What do you think the availability of the antibody test is going to be? Is it going to be, constant supply, or, kind of first come, first serve, and then a couple of weeks later you might get some more?
Yeah, that's a good question. And I have a bunch of them pre-ordered right now. So I would like to offer it to employers first. So if you feel like you want some of those that I have pre-ordered, let us know, and we can make arrangements on how to get those done for your people. We are going on site to a couple of companies to administer those tests, so that's a possibility. Or you could have folks come by the clinic. But I'd like to offer it first to employers, and then we'll offer it as well to our member patients. At Direct Med Clinic, we have a membership model. It's called Direct Primary Care. So we have a strong doctor-patient relationship with our patients. So we'll offer it to them. And then we'll also offer it to the general public, but we're not going to be real boastful about that. We're just going to announce it, but we're not going to blast it out there. We'll let that go by word of mouth and just kind of a soft launch, because there's a little bit of sensitivity and emotions around testing, and I don't want people to get the wrong idea. And I'll just mention it here in this venue that I don't want anybody to think that what we're trying to do is take away from what direction the government has given. So the government says only test folks that are symptomatic. I don't want to take away from that. I understand the PCR test is the gold standard, and they need to save that, preserve it for folks that might need to be admitted to the hospital, or healthcare workers and that kind of thing. So that's fine, but this is not that. So I don't feel that we are interfering with that direction, but on the other hand, we're using what's out there for other folks that individuals that want to use it, or employers. And then as far as how available it's going to be, the company told me that after they ship their first orders out, there might be a delay, but I don't know if that was sales talk or not. We're going to have to see. But I'll just order when I can or when I need to, and see what happens. All right, well, other questions? I hope everybody is practicing the social distancing and taking all the other precautions that we need to. Lots of hand washing and taking this serious, because it is serious, I hope that we can get this behind us soon and get back to our usual economy and our usual business. We'll plan to do another one of these next week. If you have some things that have been on your mind that you would like to bring up and have us talk about, let us know, and we'd be happy to do that.
Before you sign off, can I ask one more question?
You bet.
At my office, we have decided to do the wear mask, homemade mask. We know that that's not going to prevent spreading or getting it, but I think it would prevent spreading it a little bit. And I know it's it's controversial. Is it a good thing or a bad thing? But we just feel so desperate. We just, we're essential, I guess, now all of a sudden. And we don't know what else we can do to give ourselves a little comfort, to drop the anxiety.
Mm-hmm.
How bad of an idea is that?
So I think it's a good idea. And so that gives me the opportunity to talk about the way that it's spread. It's spread through droplets, and the droplets come out when we sneeze or cough, or even talk sometimes. So wearing a mask will catch those droplets. The droplets go out in the air about 6 feet or closer. So the mask will go a long way in catching those droplets. If you're infected, and if somebody else is infected, then unless they're wearing a mask, you might not be quite as protected, but a little bit, because those droplets could come and still land on your mask, and then you could inhale them that way. Or then you touch your mask and then you touch your eye or something like that. So the other nice thing about wearing a mask, though, is that it helps you be more cognizant of touching your face, because touching your face is a way that it goes from your hands to inside of your body, for example, through your eyes or nose or mouth. So wearing a mask and then washing your hands more will cut down the amount of times that your hands are touching your face without being washed. So I hope that helps. I think there is some benefit to using a mask, even if it's not an N95 mask or it's a homemade mask. You want to probably keep them clean, or have a few that, so you're not like wearing the same clothes every day, so you clean your mask every day. You have a new one.
Thank you.
You're welcome. Okay, well, let us know what you think. If this was helpful, let us know. And if there's some other topics that you would like to see us talk about, let us know. We'll do this again next Friday. If you know some other folks that would benefit from this, let them know.
Thank you, Dr. Roger.
All right.
Thank you.
Thank you. Have a good
Thank you.
day. Okay. Bye-bye.
Bye.
Bye.